Ask the Doctor with Michael Lange begins in 30 seconds. Ask the Doctor with Michael Lange begins in 10 seconds.
When it comes to your health, are you seeing the check engine light come on more than normal? It's time to get under the hood. It's time for Ask the Doctor with Dr. Michael Lange. Sponsored by Lange Eye Institute and Fortifeye Vitamins. Dr. Lange is a board-certified optometric physician and certified nutrition specialist, helping people see and feel better through proper nutrition for 25 years. The doctor is in. Call now with your questions at 877-969-8600. That's 877-969-8600. Here's your host, Dr. Michael Lange.
Okay, good morning and welcome to Ask the Doctor. I'm your host, Dr. Michael Lange of the Lange Eye Institute and Fortifeye Vitamins. I'm here each and every Saturday morning live to answer any and all questions you may have regarding your vision, eye care, and nutritionally related topic. I've been hosting Ask the Doctor on multiple radio networks throughout this great country and live video streaming all over the world since April of 1993. Folks, that's over 30 years. And yes, you can hear me coast to coast, or I should say you can hear us coast to coast. So it's not just Ask the Doctor, it's Ask the Doctors this morning. It's myself, Dr. Michael Lange, and my welcome guest and co-host, Dr. Susan Summerton. Good morning, Susan. How are you?
Good morning. I'm great here in the Villages. Nice, beautiful, sunny day again.
Yep, it's going to be beautiful in the Tampa Bay area as well. And I just want to mention, I'm going to brag on you a little bit. You know, you joined the Lange Eye Institute team, I know, a little while ago. And Dr. Susan is kind of an exception to the rule. She is the only optometric physician in the state of Florida that is a certified nutritional specialist like myself. Years ago, we were both at the American College of Nutrition, and we became certified at the same time. And she's also a diplomat in the American Clinical Board of Nutrition. She's a fellow in the Ocular Wellness and Nutrition Society. She's a lecturer, you know, she's a researcher, and she is the asset at the Lange Eye Institute. And I just want to thank her for joining our team and doing such a great job because patients love her. She has a great bedside demeanor. She's similar to me. Can you believe it? But female version. So thank you, Susan.
Well, I appreciate it. And I just enjoy being able to be a part of it and be able to educate and help the patients that have this interest in kind of our theory of holistic health and taking care of the eyes, the body, and the overall wellness. And we want to see improvements in people throughout the entire life.
Right. And Dr. Summerton sees patients at the Lange Eye Institute Monday through Friday. Let me give you the number. I'm going to give it to you twice to the Lange Eye Institute. Write it down if you'd like to see Dr. Summerton. The phone number is 352-753-4014. That's 353-4014. I just want to let everybody know that today I will be at the Fortifeye Nutrition Center in Clearwater. That's right there on Bayside Bridge Plaza on McMullen Booth Road in Clearwater. It's right next to the Publix and Bayside Bridge Plaza. Fortifeye Nutrition Center. I'll be there from 1 to 3. If you guys and gals want to come on out and chat about nutrition, anti-aging, wellness, or whatever the topic of the day is, come on by. I'll be there for a couple of hours. And also remember, Mandy and Mary are now at the Lange Nutrition Center in Ocala. That's the old Lange Eye Care building. It's right across the street from the Paddock Mall. Large 2-story building. Go upstairs. You can't miss it. And that's where Dr. Patrick Watson is, and also Dr. John Poser with his plastic surgery centers up there. And we've got a great group of doctors, an anti-aging wellness center called Reboot upstairs in the Ocala location also. And they do everything from, you know, hyperbaric chambers to, you know, IV cocktails. So check us out there in Ocala. But the Lange Eye Institute is open 5 days a week. And I want to tell you, we put some new technology in recently. We put the Zeiss Claris in about a month ago, and now we've got the OptoMap. And we're going to talk more about that, but it's a new generation optomat called the California. It enables us to see all the way out in the peripheral retina, looking for lots of diseases. And remember, the key is early detection. We're going to expand on that in a few minutes. We're also going to talk about a new study that is going to help all of you diabetics out there. And Dr. Summerton's going to chime in on that in a few minutes. Once again, phone lines are open. Live call-in show. It's 1-877-969-8600, 1-877-969-8600. We're broadcasting coast to coast from Salem Media. So it might be the morning where you are. It might be the evening, depending on where you're picking us up. So good morning, good afternoon, and good evening. And check us out on the website at fortifeye.com. So you can learn about the supplements that we've researched and developed at fortifeye.com. Remember, it's kind of a play on words since I'm an eye doctor. Fortifeye. That's Fortifeye. Fortifeye, fortifeye.com. And on that section, you can look at the discussion that talks about everything, the description, the ingredient profile, and then you can look at all the science behind it. None of our supplements are going to contain any of the artificial sweeteners like sucralose and aspartame in it, any dyes or carrageenan or anything like that. It's all evidence-based, and we give you the science to prove what we're trying to do to help you. Remember, God made a pretty good body as long as it's given the right fuel. All right, let's go to the first call of the morning. Everybody knows who that is. You got to get up pretty early in the morning to be Bob. Bob, good morning and welcome to Ask the Doctor.
Good morning, doctors. Pleasant Saturday. Good morning to you. I have a question that's going to go back a long time, Dr. Lange, and it's referencing to manuka honey. Okay, let me just give you a little background here. I have an area on my left ankle that has been red for quite some time. It appears to me to be blood vessels that are close to the surface. And I dinged it at work last week and opened it up. It started to bleed. So I tried to doctor it. And the 3x3 bandage that I put over it to try to protect it from my socks and my trousers, now I got a 3-inch square of little blisters. I don't know what else to say. I mean, they're little bumps. They're not blood vessels, not that I can tell. Do you think the medicinal purpose or functions in manuka honey would help this situation?
Well, you know, there are actually some Band-Aids you can buy. You can buy some Band-Aids over the counter now that are infused with manuka honey. Manuka honey does have some antimicrobial properties. It has some antiviral and antibacterial properties to it, and it's natural. You know, when you consume manuka honey, it also is filled with some enzymes and certain probiotics, believe it or not, as well. But it is sugar as well, and it has something called the manuka factor in it, and the higher that number, then the more potent these antimicrobial properties are. You know, in New Zealand and Australia, it's very, very vogue. It hasn't become as vogue here in the States. One reason it's very expensive. And, you know, a good jar of manuka honey is $40 to $50. But, you could be having some sort of allergic reaction to what you put on it, all right, if it has these little bumps, especially if it's itching. You may want to try. You could certainly try some manuka honey, all right, or you can try the Band-Aids that are infused with manuka honey. You can try soaking it in hot water. All right. And you can try, covering it for half the day and then uncovering it for the other half a day. You can try some polysporin topical, ointment on it. And obviously, if it doesn't get any better, if it gets hot and more inflamed and red, you're obviously going to have to get in and see your doctor. Okay.
Okay. Well, it's been a long time since I've talked to you about manuka honey. And I thought, back at the time we were talking about it, we were talking about it being very good for diabetic lesions.
Right.
Things of that nature. So I thought.
Absolutely. There is some limited science out there, and there's some studies that have shown it that people can use it, especially diabetics that have poor peripheral circulation. They heal a little slower. But the question is, isn't any better than topical antibiotics? Is it doing the same thing? it's a good question. I've never seen any double-blind placebo-controlled studies where they test them both. But like I said, if it gets worse, you got to get in and see your doctor. But oftentimes you got to make sure these things aren't infected. So hopefully you washed it really good with a good soap, all right? And then maybe soak it in some hot water. Yeah, like I said, try a thin layer of the manuka honey. You may want to put a bandage covering it just for half the day and then leave it uncovered for the other half a day. And then if it's worse, on the weekend, go to one of those, local urgent care facilities.
Okay. Very good, doctors. Thank you so much. Have yourself a wonderful weekend.
All right, Bob. Take care. All right. Once again, you're listening to Ask the Doctors. Dr. Susan Summerton of the Lange Eye Institute and Fortifeye Vitamins. And Dr. Summerton, we got a little road trip ahead of us, don't we?
We do. We're off to the Florida Optometric Association meeting with all the eye doctors, not only from Florida, but we attract many doctors from all the United States. And we're going to be there with Fortifeye. We're going to be taking classes ourselves, enhancing our education. I'm going to be attending some business meetings. As president of the West Florida Optometric Association, part of our job is we've got to discuss all the politics of our eye care, which is important these days. And so we're accomplishing a lot within this 3 or 4 days we'll be there.
Yep, we're looking forward to it. I'll drive down Wednesday after work, and we'll be there Wednesday night, Thursday night, Friday night, Saturday night, and head back to the Bay on Sunday. All right, let's go to the phones. Janet in the Villages. Good morning, Janet. Welcome to the program.
Thank you, doctor. My question is about eye drops. And I just saw you Thursday with the final follow-up for my cataract surgeries, and that was really good news. But I meant to ask you when I was there if the drops that I still have left would be good to use a few more days or not, because I had to refill a couple of those. And as you know, if you remember, I'm kind of pretty much anti-drug, but pro-nutrition. And I don't want to put anything in, but I thought maybe, it's good to add a couple days to that regimen or not. And then the other question is just the regular, drops to get a little more moisture into your eyes, which I need most of the time. Are those good to do like every day or just once in a while?
Yep. First, let's address the first question. Your post-operative drops are done now. You had a non-steroidal drop, a steroid drop, and an antibiotic, and you used them for the entire period of time post-operatively. You don't need to use those anymore, okay? More is not better, so stop those. However, a good lubricating eye drop, a preservative-free lubricating eye drop like Oasis Tears Plus or Optase. Those are my two favorite, especially post-cataract surgery, because they have something called sodium hyaluron, which is hyaluronic acid in it, which is kind of a natural anti-inflammatory. It binds to the epithelium. It lasts about 3 to 4 times longer than the typical over-the-counter drops. And you can do a little test. You can take a drop of Oasis Tears or Optase, put a drop on your fingertip and rub it back and forth, and then take something over the counter. I'm not going to mention any names, but over-the-counter drop, put it on your finger, rub it back and forth. The Oasis and Optase, 5 minutes later, it's still slippery. The ones you buy over the counter, literally 5-10 seconds after doing it, it's bone dry, and the fingers don't have any lubricating properties. So we need to do that. Remember, especially 3 to 4 months after cataract surgery, your eyes tend to be even a little drier after having this procedure. So make sure you hydrate enough. Eat a banana, an avocado, or some purple potatoes daily, because those are high in potassium. A potassium deficiency can aggravate a dry eye. Dehydration obviously can aggravate a dry eye. And I think there may be a link to dry eye and atrial fibrillation. I really do, because I see it in my patients. Remember, I've been seeing a lot of patients in the Villages for a long time. My average age patient is 75, 78 years of age. And the drier their eyes are, the more likely it seems to them having atrial fibrillation. When you think about it, if you're dehydrated and you're deficient in potassium, you're probably more likely to have atrial fibrillation. That's one of the reasons you have dry eye. So none of us want AFib. So treat your dry eye, and just maybe, you might be less likely to have AFib. Now, obviously, you still got to see your cardiologist.
Okay, now I looked in the fridge to see what the 2 big, full, brand new boxes of eye drops I had, and they were Bausch and Lomb Soothe, non-preservative.
You know, that's a decent artificial tear. What I want you to do is do that little test. Take that drop, put it in your fingertip, rub it, and see how long it takes before, between 2 fingers it dries out. And then if you have any Oasis or Optase, compare it. I think that drop is fine to use, but post-operatively, I like something that has some HA, hyaluronic acid in it. So read the other ingredients. Usually they put it in the other ingredients and see if it has sodium hyaluron or HA or hyaluronic acid or something like that. And there may be some over the counter now that you can buy that has that. If not, you can always come to the Lange Eye Institute, pick up one of those, or you can go to fortifeye.com. We have it on the website as well.
Well, I believe the one I got was on the list of good ones with the doctor that did the surgery.
Right.
And I think that's why I went ahead and those I could get through my insurance for free.
Well, free is good. Free is good.
Yeah,
but remember what your mama said. You don't get anything for free.
That's true. Okay, well, thank you much.
All right, Janet. Take care.
We'll see you soon.
Bye-bye. We got a lot of great patients, Dr. Summerton, don't we?
We do, and that brought up my thinking about the dry eye. Sometimes after the cataract surgeries, this dry eye does persist up for about 6 months. And then we do things like those punctal plugs, where your tear drainage, where your tears are going down, we put in different kinds. We have collagen that dissolves, sort of as a test to see if we can get improvement. And then we have ones that last up to 6 months, which are my personal favorite because they go down in the tear ducts. You can't feel them at all. And they just naturally dissolve after that 6-month period of time, which is usually the time zone that we're looking for, while we do work on the other things, such as changes with the diet, getting the fish oil, the good quality triglyceride fish oil into their diet, and making sure they stay hydrated, improving those glands, and just taking them through that time when they might struggle with the dry eye to keep their vision more stable, because those fluctuations in vision after cataract surgery sometimes is just because of dry eye. And we also make them feel better and see better.
Right. And dry eye, especially with the majority of our listening audience here in Florida, is a big problem here in Florida. And one reason, quite frankly, because the older we get, the drier we get. Also, many of the medications that we're taking today can dry us out. The lack of certain nutrients can further dry us out. Environmental factors can dry us out. And remember, some of the symptoms for dry eye are eyes that feel sandy, gritty, burn, tear, itch, fluctuation in vision, recurring infections, all of these. And, we always like to talk about, we heat them, we clean them, we nutrify them, all right? So we heat the glands, we clean the lids, we nutrify the glands with the omega-3 and the GLA, the black currant seed oil. The combination of those work very well. Fortifeye Super Omega, if you're less than 200 pounds, Fortifeye Super Omega 3 Max, if you're over 200 pounds. And the good lubricants like Oasis Tears Plus, Optase. I even like Retain. Retain is a pretty good lubricant, or alternating something like Oasis and Retain if you have really dry eyes. But like you mentioned, Susan, punctal occlusion and punctal plugs is something that is really underutilized by optometrists and ophthalmologists, and it works. And the thing is, all plugs are not created equal, are they?
No, they're not. Some of them, if people have had them in their past, they may recall that a lot of them end up popping out, or you can feel them in your eyes. So we tend to stay away. We've had enough experience to kind of work with, which works and which doesn't work. And we want to do the best for each unique patient. So we do use different kinds on different patients. They come in all shapes and sizes as well. And we're constantly looking for what's the best on the market.
Right. And like you said, we've got collagen plugs that dissolve anywhere from 3 to 5 days. We have some that dissolve 3 months to 9 months. And then we have the permanent ones, and they're all different shapes and sizes. And we keep literally thousands of different combinations of these punctal plugs. And remember, folks, this is covered by your insurance. It's a painless procedure. It's not like having a tooth pulled. Although I got to tell you, Dr. Angela Emmerich at VIP Dentistry in the Villages right there in the Lange Eye Institute pulled my wisdom tooth about 2 weeks ago, and it was painless. They did an amazing job, and I wasn't asleep. Little local anesthesia, it's 5 minutes. So these little plugs are so simple, painless. You don't really even need an anesthetic, but we're nice people. We put a little numbing drop in so you don't feel it. And when you think about it, it's like putting a stopper in the bathtub. If you put a stopper in the bathtub, the water stays in the tub. If we put a stopper in the drainage ducts in your eyes, you still produce the tears. They just don't drain out back into your throat rapidly. So your tears, which are better than artificial tears, bathe your eye, and your eyes go, thank you. Or when you put an artificial tear in your eye, it stays on your eye a lot longer. Remember, this is covered by your insurance. Any optometrist or ophthalmologist can do it. It's really fairly quick. We do a lot of that. That's one of Dr. Summerton's specialties. Also, Dr. Caputi at the Lange Eye Institute, one of her specialties, and of course, me as well. So think about punctal occlusion or punctal plugs if you have dry eye and you've tried just about everything else. I think you'll thank us. All right, we're getting ready to go to the next caller. If you'd like to call Fortifeye Vitamins, I'm going to give you the number twice. Write this down. Fortifeye Vitamins is 866-503-9746. That's 866-503-9746. And you can go to the website at fortifeye.com. That's Fortifeye, fortifeye.com. And go to shop and then go to dry eye, and you can see all the information we have on dry eye and all the supplements. Remember, I always recommend the omega-3 first. If your eyes are still dry, adding GLA and adding astaxanthin. We have a product that doctors are recommending all over the country, if not all over the world, called Fortifeye Advanced Dry Eye Therapy. And what that is, it comes with 3 bottles in a box. It comes with the omega-3, the Fortifeye Focus, which is 4 carotenoids, plus the black currant seed oil GLA. And we're going to expand on that. If I recall, last week, Stephen had called and asked for me to talk a little bit about the differences between black currant seed oil, evening primrose oil, and borage oil. And that's where we get this GLA that helps dry eye. And we're going to expand on that if we have a moment. I didn't forget, Stephen. So check it out. Advanced Dry Eye Therapy. It's discounted dramatically. No charge for shipping, and it's at fortifeye.com. All right, let's go back to the phones. We're getting totally loaded up. Alice in Sarasota, good morning.
Hi, good morning, Dr. Lange. Thank you for taking my call.
My pleasure.
My question this morning for you is, do you do nutritional support or consultation for patients with chronic uveitis?
Absolutely. That is kind of one of the areas that we specialize in. Not a lot of doctors do that. And just off the cuff, I can tell you a few things pretty quickly. For people that are listening, uveitis and iritis is a chronic condition where you have inflammation inside the eye, and it causes light sensitivity. It can cause scarring. It can cause blindness if it's not treated accordingly. And so there is many good studies out there that show that if you use a good form of curcumin, I said a good form of curcumin, quite frankly, there's not that many good forms because they're not bioavailable. That's why we developed something called Fortifeye Next Gen Curcumin. It has something called Curcumin in it, and it's 500 milligrams of the only oleoresin food grade curcumin available. It absorbs amazingly well. I'd probably say a few hundred patients that I've put on a combination of that and our Fortifeye Super Omega, or a good triglyceride form omega-3. I call that the double whammy for uveitis, all right? And it's called Omega Relief when we bundle them together and you get a discount. So if you look on the website, it's called Omega Relief. It's a combination of our curcumin and our triglyceride form omega-3. So this helps hit many of the inflammatory components in your body, the prostaglandins, series 1, series 2 and series 3 prostaglandins. If you add black currant seed oil, that hits series 1. So it hits all the prostaglandin, helping with inflammation. Now, obviously, you also need to find out the underlying etiology of this, Alice. So if your doctor hasn't done any blood work, your primary care physician may want to do some blood work to find out why you have this chronic uveitis. It could be related to, inflammation in your body, a collagen vascular disease, an autoimmune disease like rheumatoid arthritis or something like that. So they need to find the underlying etiology, adjusting your diet to a Mediterranean diet, or a diet, which would even be better, is my Lange survival diet. So getting on the Lange survival diet, maintaining a good weight, a good night's sleep, hydration, taking the curcumin and the omega-3, and then obviously seeing your optometrist and ophthalmologist per their instructions, you sometimes often have to be on a low-dose steroid daily. But my goal is to get my patients off of that low-dose steroid, okay?
Fantastic. All right. Thank you.
All right. Hope that helped a
Appreciate
little.
your time. It
Bye-bye.
would. Thank you. Bye-bye.
And then certainly
The tumeric and the curcumin we've been using. There was a study way back in 1999 that had showed that oral curcumin taking 375 milligrams 3 times a day helped that uveitis. So we've been using the curcumin for years and years. You'll take the higher dose while the uveitis is active, along with the steroid eye drops, and then lower the dose as prevention, because uveitis can be recurrent. So we want to do all we can to prevent it coming back, because there is severe complications of that uveitis.
right. And that's, not to brag, but we're one of a select group of eye care centers, certainly in Florida, that would even, offer you this type of information. So check us out at the Lange Eye Institute in the Villages, Florida. And the phone number is 352-753-4014, 352-753-4014. And Dr. Summerton is available for new patients, and you will love her. All right, let's go back to the phones. Jennifer in Ocala. Good morning, Jennifer.
Good morning, Dr. Lange. And Dr. Summerton, I have enjoyed your shows so much. I mean, when you talk about dry eye and all the preventatives and all the ways to fix it, you've just changed my world. I mean, you and Dr. Lange. I've been riding horses my whole life and competing, and I've got, blue eyes, light eyes, and I used to get the worst, like dry eyes, and I always thought it was the elements, out, riding in the sun and the heat and the sand and the, what. And I started Fortifeye Focus about 2 years ago. I haven't looked back. I mean,
That
I
is
have not
amazing.
had any yeah, honestly, I have not had any. It's the only thing I did different. No, let me back up. No, I didn't. I started using Oasis Tears, the Oasis drops, and but my eyes are like, people say, God, you've just got these light in your eyes. Your eyes are so bright all the time, and believe me, they used to not. I looked like 10 miles of rough road when I got done riding a horse. I mean, my eyes were like, bloodshot and tired, and they were always tearing. I'd wake up in the morning and they were closed shut, and so thank you.
Well, I'm going to
so much.
go ahead and chime in on that, and I'm going to chime in after you, Susan.
Yeah, we love that patient feedback, because that's what we're looking for, results. And we want to hear the good and the bad to know what we're doing affects each patient in a positive way. And that focus that you're taking is one of my favorites. That has that lutein, the zeaxanthin, and the astaxanthin. So you're not only just helping with the symptoms that you're having, you're helping prevent down the road things like macular degeneration, because there's been studies that shows it helps hold on to that macular pigment, and that's what absorbs all that light coming into your eye. The more macular pigment you have, the better off you are, less chance of macular degeneration. A lot of athletes like it because it improves their vision when they're playing outdoors. And with you horse riding, obviously you're outdoors all the time. You're also protecting your skin with that astaxanthin that's in it. So great job. Keep it up.
Thank you. Oh, thank you. And also, I wanted to chime in. I'm at an age, I'll be 62 in October, and I'm just very aware that everybody's aging. It just, there's two choices, age or die, right? So I'm hearing all these things
sound
about,
like you're 32.
Well, you can ask Dr. Lange. I'm kind of a very unique 60-year-old. So anyway, but your Alzheimer's early detection from an eye exam, when I listened to your show, seriously, and I'm not blowing sunshine up your skirt, I'm being honest. Like, when I listen to your show, and every time I get like a new nugget of information, and that early Alzheimer's, that you can look at an eye and you can see, if we are, eligible for that lovely disease, right? That I'd never heard of that before. And So I'm going around telling everybody about it.
Well, the eye,
So there you go.
Jen, the eye is the window to the body. And so the eye doctor is one of the best doctors to help detect oftentimes many diseases, like the first telltale signs of dementias and Alzheimer's, neurodegenerative diseases, but also some of the first signs of hypertension and diabetes and thyroid problems. Even, believe it or not, STDs, sexually transmitted diseases, can show up in the eye. So it's a good form of prevention, seeing your local optometrist or ophthalmologist annually. The key, once again, is early detection. And I want to go back to your first section, talking about the dry eye and the focus. I was the first literally in the world to find a direct correlation between astaxanthin and dry eye relief. And this is, 15 years ago. We were doing some dry eye studies, and I found that was with omega-3. We're doing omega index blood studies and omega-3 studies. And we found when we added our Fortifeye Focus that had the lutein, zeaxanthin, and astaxanthin to it, inflammatory components dropped even more, and people with dry eye improved. And then, therefore, real astaxanthin, shortly after that, started doing some double-blind, placebo-controlled studies with astaxanthin, proving that it actually is one of the components and ingredients and nutrients that can help support dry eye and help improve tear quality. So the Fortifeye Focus, that's why we added that to our omega-3 and our black currant seed oil in a combo called Fortifeye Advanced Dry Eye Therapy, which is also great for your joints, skin, hair, nails, and heart and brain. So not just for dry eye. Jen, thanks a lot for all those positive accolades.
Well, like I said, I'm at a point in my life where if I don't have anything good to tell you, I ain't going to say nothing. So there you go.
That brings back a song, an old song. What is that, like Kacha
I
Khan or something like that? Tell me something good.
That's it. Listen, that's my new thing. When people call, I'm going to be like, tell me something good.
What a song. Thanks, Jennifer.
You're welcome.
Thank you, Jennifer.
Dr. Summerton, congratulations on being with the best friggin' practice in the world. I mean, you guys are going to, well, you already are, but you're going to continue to change the world in a good way. So thank you.
Thank you.
Thank you.
Wow.
Bye. Bye.
Tell me that you like it. Yeah. What a song. Thank you. All right. Good morning again. Welcome to Ask the Doctor. My head's going to be too big. I don't think Dr. Summerton will be able to get out of her house either. Her head's going to be too big. All right. Stephen's been waiting patiently. Let's go so we can retrieve Stephen. He's been on hold for about 10 minutes. Steve, good morning.
How are you? Listen, did you save the tooth that was extracted?
You know me. When I had a kidney stone, I saved it, and I saved the tooth. The dentist was wondering. She was getting her throat. I said, give me that sucker. And she said, what? Yeah. So she cleaned it up, put in a plastic bag. I got that tooth.
Yeah. Well, if you ever would get osteoporosis or something, you know how blood sugar, you can take a glucose level test and they'll tell you what your sugar is right now. But if you take the A1C, it tells you what it's been over a period of time.
Right.
Well, in the same way, when you take hair analysis for minerals, it can only tell you what your mineral intake was for the short period of time that hair grew,
right.
The last month. Whereas the tooth will give you a lifetime average of certain minerals, which are important to tooth osteoclast versus osteoblast metabolism in the teeth. And you can tell over a lifetime what minerals you've been deficient on and what minerals you maybe have too much of. And ironically, taking too much calcium can actually do more harm than good for osteoporosis. So it's something that, it's just something you could do. You have to, I think it's neutron activation analysis or something.
Wow, that
but
is
it can
cool.
It can give you a lifetime reading of the average intake of certain minerals.
And you bring up a valid question also on another subject. Too much calcium is harmful. That's right. And so you shouldn't just be willy-nilly taking 2,000 milligrams of calcium carbonate or something like that, because if it's not absorbing into the bones, it's circulating through your vascular system. And there's studies out there that indicate it could increase your risk of macular degeneration because it's causing calcification of all of these little arteries that feed the retina. So that's why we like, using certain things with certain types of calcium, using a good form of calcium that's not too high, that is combined with vitamin D, vitamin K1, or at least K2, magnesium, phosphorus, iproflavone, or strontium, or a bone olive. There's lots of things that can help it. And there's kind of a science behind the nutritional integrity of absorption of calcium into the bone, so it's not just circulating. And that's, once again, why you see Doc Hall at my office, or me, or Dr. Summerton, because, we like to discuss these things with our patients to decrease their chances of having, negative side effects from too much of a good thing.
Well, these all these companies, they like New Smile and all these companies that do dental implants.
Right.
In Japan, it's normal procedure. It's not even optional. Whereas about a couple months before you have bone implants or tooth implants, they put you on vitamin K to build up the bone mass in the jaw and mandible and the maxilla. So why we don't do that here, I have no idea. But it's a massively beneficial to the patient that's going to get bone implants.
Absolutely. Steve, as usual, you always got some great information. Thanks for the call, my friend.
Okay, I'm glad you're feeling better from the tooth extraction.
Yeah, me too. Me too.
Yeah.
Thanks.
Okay.
All right. Bye-bye. All right. And before
for all our callers out there, please do not take a calcium without a good quality magnesium in it. That's super important.
Yes, that is so, so true. And for those of you that are really into the natural aspects, go walk on the beach with minimal clothing in the sun for 30 minutes, all right? Without sunscreen for the 30 minutes, unless you're obviously an albino or you have some sort of drug that keeps you out of the sun. But a half hour of sunshine without sunscreen, if you're going to be out there longer, then you probably want to cover up or have some sunscreen. But walk barefooted, a little weight-bearing exercise, eat a can of sardines with some cooked kale while you're walking down the beach. And it's got to be the whole sardines with the bones, because now you're getting good omega-3, good protein. You're getting the good form of calcium from those bones. You're grounding. You're getting vitamin D, and you're getting the vitamin K from the organic cooked kale. And that'll be a picture, won't it? Susan, everybody walking down the beach with a can of sardines and some cooked kale in their Speedo. All right. Before we go to the next call, I think it's John. Hold on just for a minute longer. I just want to mention something we were going to talk about last week, but we didn't have time. Black currant seed oil, evening primrose oil, or borage oil is the question. Most of you are going, what's that? Well, this is one of the only ways to get GLA, gamma linolenic acid. GLA is a natural anti-inflammatory from the omega-6 family. Remember, most omega-6 is pro-inflammatory. However, GLA is anti-inflammatory. So borage oil, evening primrose oil, or gamma or a black currant seed oil, the question is, which is best? Well, I researched this for years before we came out with Fortifeye black currant seed oil GLA with 140 milligrams of GLA. The reason I use black currant seed oil, it's the only one of the three that actually has ALA with it. Not only has GLA, it has ALA. That's alpha linolenic acid. That's a plant-based form of omega-3. It converts to omega-3. So we get two, omega-3 and the GLA. I don't like borage oil. Borage oil actually has more GLA than black currant seed oil. But some borage oil has an alkaloid that can cause liver damage. So I recommend staying away from borage oil. And evening primrose oil just doesn't have enough GLA in it, and it doesn't have the ALA the way black currant seed oil is. So that's why we developed Fortifeye black currant seed oil GLA, to get the anti-inflammatory properties of that form of omega-6. And that's one of the only ways of stimulating series 1 prostaglandin. That's anti-inflammatory. And let's face it, who out there is eating black currant seed oil? Not many of us, so you can get it in a supplement made by Fortifeye. All right, we're going to John. He's been waiting patiently. John and Holiday, thanks for holding, my friend.
Yes, doctor. I have dry eyes, but would like to use my air conditioning and fan in the bedroom at night because it's so hot now. Any advice, please?
So I like the air condition on at night here in Florida, and I like the fan too. The fan helps me sleep because, number one, I crank it up really high, so it takes the cool air, and it's like a blizzard in my bedroom. The only problem is if you have dry eye, the fan ain't the best thing in the world, because of those wind currents can really dry your eyes out considerably, and you can wake up and they can be just about glued shut and painful, and you can have blurred vision for quite some time. So you can try putting a lubricant in your eye right before you go to bed. And when you get up in the middle of the night, excuse me, to urinate, then put a lubricant in then, or you could wear a sleep mask that keeps your eye closed if you want to have the ceiling fan on, right? And you're probably doing the things we preach, drinking enough water, taking the omega-3, the focus, the black currant seed oil. These things are all going to help. But another trick of the trade right before you go to bed, John, is take a hot washcloth, all right, or something like those masks you put in the microwave, and put it on your eyes 10 minutes right before bed. That's going to open up the meibomian glands and then clean them. Wash the lids off really good so you clean all the bacteria that comes out. So you heat them and you clean them right before bed, and I bet you your eyes are better in the morning.
Okay. All right. I appreciate your advice. Thank you so much.
All right, John. Thanks for the call. Susan, we see this a lot. I mean, wind currents in the bedroom, if the ceiling fan's right over you, it can be a problem for some of our patients with dry eye, can't it?
Yes, and when we question our patients trying to figure out the origin of what's causing the dry eye, that's one of the questions that we do ask. Do you sleep with a fan? Because it is pretty common that will dry out your eyes. Your eyelids are the only skin in your body that doesn't have that subcutaneous fat, and that actually allows the air to pass through it. We want the air to pass through it, get the oxygen to your eye, but then that includes drying out your eyes more when the wind is blowing on it. Of course, I'm a big fan of being cool while you're sleeping too, so I like the air conditioner running too. But all the things you said, that nice protective oil layer while you're sleeping, that's going to help a lot. I love to tell patients, and I do it myself, when you first get up in the morning, before your coffee, drink a glass of water. That should be the first thing that you put in your mouth, is to just hydrate yourself right away. We all wake up a little dehydrated. So just from breathing dehydrates us. So we want to do that and get a good start to our day. And along with the good quality fish oil, the black currant seed oil, and the focus on a daily basis.
Right. And that's called Fortifeye Advanced Dry Eye Therapy. Remember, you can get it at fortifeye.com, Fortifeye, fortifeye.com. I'll give you the phone number for Fortifeye Vitamins. It's 866-503-9746, 866-503-9746. Also, sign up for our newsletter. We'll send you lots of good information, studies and science, and some promos also frequently. And you sign up for our newsletter at fortifeye.com. Go to the bottom of the page, and there's a section, newsletter. Just click on it, and you put your email in, and then you'll be connected to us. All right, phone lines are open. We're getting ready to go to the next call. If you got a question, give us a call at 1-877-969-8600, 1-877-969-8600. I'm Dr. Michael Lange with my co-host, Dr. Susan Summerton. We're both board-certified optometric physicians as well as certified nutritional specialists hosting Ask the Doctor. All right, let's go to Lillian in Largo. Lillian, good morning. Welcome to the program.
Good morning. Doctor, I have dry eye and I have macula, and I've been taking the fortified combination of yours, but I developed on my left eye, and it turned out to be the black spot, and I have wet macula there, they told me, and dry on my other eye. Is there anything that I can take then if they're giving me needles? Additional for the wet macula?
Well, yeah, the needle you talk about, that's an anti-VEGF injection. That's very important when you have the wet form of macular degeneration. It's a little scary, but it doesn't hurt. They put an anesthetic in the eye first, and this has been a godsend really for our patients. You know, I was in, this business for a long time, and we used to see patients with wet macular degeneration go blind very rapidly. So now with the injections, it's a good thing. But the combination of the right diet, all right, the right foods, the right supplements. So you're taking the Fortifeye, which will help support your retina, okay, combined with the visits to your retina specialist, and wearing a good pair of sunglasses in the sun is very important. Now, just to give people a little hope, there's actually a study underway right now, and there were some studies that have already been published about topical drops that act and do similar effects as the injections. So I am thinking in this not so distant future, the injections in the eye might not be as mainstream, because some of these topical drops have a vehicle that allows these drugs and these type of enzymes and anti-VEGF activity to go into the eye through the cornea and to the retina. So the question is, when will it become very vogue? But I think the needle in the eye is probably going to be gone sometime in the not so distant future. Now, is that 1 year? Is it 15 years? I don't know yet.
And also, doctor, someone told me that in Texas, doctors are injecting blood into the eye to get rid of the retina. Have you ever heard of that?
Well, that's interesting. I mean, they're doing a lot of things. Well, injection of stem cells, especially. They've been experimenting with fetal stem cells. And as far as blood goes, I'd have to research that more and see what they're actually doing. And I can certainly talk to some of my retinal colleagues about that, and we can expand on that. I'm writing that down right now. Injecting blood into eye for macula. So we'll expand on that more after I do a little bit more research on it. I don't like to talk about something that I don't know at least a little bit about, okay?
Okay, now I have another question, and that is, do you think or do you know of or heard of, I have been taking a neuro, and my doctor changed me, inhaler, changed me to Trendology, and on TV they say that it's possible that damage the eye. Now, do you think possibility or if know of? Maybe that's why.
What drug was that?
If I'm saying it right, it's an inhaler for COPD.
Oh, okay.
Trendology.
So many inhalers do have certain medications. A lot of inhalers have actually steroids in them, and that can have some. Yeah, can sometimes have some confliction with the eye, especially with elevated increased intraocular pressure, aka glaucoma. However, you need to do what your doctor says, and then they can monitor you, because remember, most side effects of these drugs can be treated. So an inhaler can keep you alive because you can be breathing, right? So that's a good thing.
Right.
And so when you're on this inhaler, it's probably a good idea to see your local eye doctor, have them check your intraocular pressure, let the doctor know that you're on it. And if they do have any potential side effects, they can treat it fairly easily, okay?
Okay, because I thought maybe I'd call my pulmonary doctor and say I'd like to go back to a neuro because that doesn't have a steroid in it, which the other one does.
Well, he probably switched you to that drug for a particular reason. So you can certainly talk to your pulmonary doctor, but most people aren't going to have a negative reaction to that. And remember, oxygen is very good.
I see. Yes, it is, of course. Okay. Now, should I take anything additional besides the combination that I'm doing for the dry eye of yours?
Well, I think if you're taking something like the Fortifeye Advanced Dry Eye Therapy or the Omega-3 black currant seed oil focus, I think that's probably going to cover all your bases from a nutritional support standpoint. Also, you can look at our section that says Fortifeye Macular Defense and read that information under it on the website, okay? Read the information under Fortifeye Macular Defense, and that'll give you some really good information also.
All right, wonderful. Thank you. Have a wonderful weekend.
All right, Lillian, thanks. And Dr. Summerton, we don't have a lot of time, but, wait, you chime in a little bit on that new study about the Mediterranean diet.
We were brand new, hot off the press in July, just this month, is talking about the Mediterranean diet and specifically diabetic retinopathy. So that diet with the fresh fruit, and vegetables, nuts and seeds, some good quality olive oil, seafood, that has been shown to actually prevent that diabetic retinopathy and help what we call those microvasculature, all those little tiny blood vessels that receive that stress from all those high blood glucose. So we help just by changing our diet. You're not only going to help prevent diabetic retinopathy, but you're probably going to also help prevent neuropathies, protect your kidneys and your heart. You're going to have so many benefits. And we now have a study that actually proves it.
Right. And that's the Mediterranean diet. And I like to take it to the next level. If you go to the Lange Survival Diet, Google the Lange Survival Diet. It's basically the Mediterranean diet, but I've taken some of the foods out of the Mediterranean diet that are high in some of the anti-nutrients like oxalates, phytic acid, and lectins. So I've just taken some out of the Mediterranean diet, but the omega-3 is very important from the good quality fish also, because there's a study that you can look at also at healthbenefitsofomega3.com, healthbenefitsofomega3.com, talking about omega-3 for diabetic retinopathy as well. Wow. Susan, you better tell everybody goodbye. We're about out of time.
Wishing everybody a beautiful day. I'm off to the farmer's market myself. God bless.
Thank you, Susan. And remember, check us out on the web at fortifeye.com, Fortifeye, fortifeye.com. And come see Dr. Summerton at the Lange Eye Institute in the Villages, Florida. With that, I'm out of here. God bless you, and God bless America. Have a great Saturday.